You know how Republicans kept saying that their healthcare cuts wouldn't hurt anybody right away? Well, they lied. It turns out hospitals are already closing, people are already losing their health insurance, and it's only been 2 weeks since Trump signed the bill. To start with, some Planned Parenthood clinics are already turning away Medicaid patients. In one region, they said they can't see these patients at all, even if they pay out of pocket. UCare in Minnesota just dropped 88,000 patients from Medicaid coverage. Curtis Medical Center in Nebraska closed. Lady of the Angels Hospital in Louisiana about to close. Garnet Health in New York laid off 42 people and cut diabetes and lung rehab services. Providence Healthcare, one of the biggest hospital chains in America, just cut 600 jobs across 7 states specifically because of these federal cuts. UC San Diego Health laid off 230 workers. Community health centers are looking at closing 1,800 locations and cutting 34,000 jobs. These are the clinics that serve the poorest communities. Think you're safe because you have private insurance? Think again. Blue Cross Blue Shield in Illinois wants to raise premiums by 27% next year. Texas Blue Cross wants 21%. Washington, Georgia, Rhode Island, all over 20%. And here's the kicker. The subsidies that help people afford Obamacare plans, those expire at the end of this year thanks to Republicans. So you're getting hit with massive premium increases and losing the help that made them affordable. So let's get this straight. Hospitals are closing, Medicaid is getting gutted, and your private insurance premiums are about to skyrocket. This isn't just poor people getting hurt, this is everyone, and it's starting now. 5 states are already calling emergency legislative sessions to figure out what to cut next. Your state could be one of the 5. This isn't some future problem. People are losing healthcare today, and our bills are exploding.
So yesterday, I received a flood of DMs from CHLA staff, past and present, and what they're describing is very disturbing, and I want to bring this to you. So veteran employees were offered retirement packages, and if they declined, they had to sign away all future raises. The surgical admitting department has been completely dissolved, and leadership told staff that the hospital has a $60 million deficit, mostly due to Medicaid cuts, and CHLA's patient population is over 75% Medicaid, just like many children's hospitals across the country. But here's the contradiction. While permanent staff are being laid off, travel and locum contracts are still active. Leadership has even said that travel nurses are cheaper. That's the priority. Multiple people have told me firsthand that CHLA cut nurse managers and educators during COVID, and now they're pushing RNs into salaried supervisor roles, more responsibility, but no overtime. So if you say no, you're gone. One former staffer shared they tried to transfer departments, but a sudden hiring freeze blocked it. And after they left, CHLA called, asked if they still wanted the job, but that the whole department is now dismantled. I received another message that described how leadership offloaded billing issues onto staff. So instead of addressing coverage or authorizations up front, workers were told to see if the department can eat the costs. So even when red flags were raised, leadership said, just push through it and we'll fix it later. I did receive several messages that confirmed that employees received layoff letters and are being forced to reapply for their own jobs. They're expected to keep working through October until leadership decides who stays. 2 months ago, staff were told that there would be no clinical layoffs. Now they've brought in a third-party firm, and people are being picked off department by department. And yes, CHLA is reportedly under FBI investigation after pressure from Trump and his allies who claim the hospital's gender-affirming care program is mutilating children. So this is a lot, and this is what frontline healthcare looks like in 2025. We have scandal, we have lies, we have political interference, and a system that keeps punishing the people, the actual people that's doing the hard work. They deserve better, and I'll keep making sure that they're heard.
If you're pregnant, or you know someone who is, or you think you might want to have a baby one day, can you give me just a couple minutes of your time, because I have some information that you might not be aware of. Hi, my name is Kathleen, and this is Pushed Out, where I am documenting my journey looking into maternity unit closures around the United States. Did you know that 35% of the counties in the United States are maternity care deserts, which means that in those counties there is no hospital offering maternity care whatsoever, and there's no OBGYN offering any kind of services whatsoever. That's a little crazy. So the only reason I know this at all is because last year when I was pregnant with my second child, about 2 months before my due date, I learned that the hospital I was using was going to be discontinuing labor and delivery services about a month after my due date. So it was not going to affect me. However, it was in that moment where I was like, is this legal? Is this allowed? I guess I always assumed that having a safe place to give birth was almost like a right. And it was in that moment that I realized that I guess it wasn't. And so life went on. Last February, I learned that another local-ish hospital was also going to be discontinuing its labor and delivery services. So with that hospital closing down, there was now a 7-county maternity care gap in Pennsylvania around the area that I live. And so it was then, after I heard that I was like, okay, this is insane. I need to look into this a little bit more just for personal interest. It's like, is anybody going to say anything? Is anybody going to do anything? Are we just going to let this kind of continue? Where's this going to stop? And so I hopped right on the crazy train and read every single article that I could get my hands on just to learn a little bit more. And what I found out was that this is not a rural Pennsylvania problem. This is a United States problem, and it's happening in all areas of the United States. And so I want to tell you what I'm learning. I am not an expert. I'm not a doctor, but I am just a person that's interested in the problem that I would like to share with you and to make sure that everybody is aware of what is happening.
So where are all of the people that kept saying that we weren't going to feel the effects of what Donald Trump was doing with the cuts to Medicaid and healthcare until the 4 years were up? Where are all of the people that kept saying that we were not going to be dealing with the negative consequences until we were closer towards the ending of his second term? Where are y'all at? Because as of today, did y'all know that there are 65 hospitals that are closing? That healthcare professionals are coming out, nurses, doctors, stating that they are getting laid off? Huh? Did you know that there are programs right now that are desperately trying to consolidate with other programs and other organizations just to keep the doors open? What happened to we weren't going to feel anything until the 4 years were up? Go to nurse.org if you think that I'm lying. Look at the title of that. Hospital layoffs escalate. Impact spreads from support staff to nurses. And this was in July. This is what we're dealing with now. 65 hospitals. And if you go to the website, you'll literally see all of the hospitals that are closing. But y'all said that we weren't going to deal with anything until that 4 years were up. You said that we weren't going to feel the impact of this until the 4 years were up. Right now, not even the blue states are safe. They're not safe. States like New York can probably foot the bill for maybe 6 months, maybe 7, 8 months. And it's going to impact everybody, not just those who depend on Medicaid, but even those who pay for private insurance. We're all about to feel it now, not in 4 years, now. If we keep paying federal taxes, if each state keeps sending in the federal tax that they collect to the Federal Reserve, the death toll is about to skyrocket. It's going to skyrocket. And maybe this is why everybody is fleeing America. The wealth is literally fleeing America. Everybody's moving to the UK.
Illinois, you need to see this. Behind me is a list of over 300 rural hospitals that are at risk of closing because the big, beautiful budget bill passed. 9 of them are in Illinois. If you are in central or southern Illinois, this means your healthcare, your hospitals, and your food are on the chopping block. While 7 of those 9 hospitals do fall in District 12, that is actually Mike Bost, I'm going to be talking about District 15 for the most part today. This is Representative Mary Miller's district. so-called Big Beautiful Budget Bill will kick off 330,000 Illinoisans off their medical insurance. Food assistance programs for over 12,000 constituents in Mary Miller's district gone, just like that. 29,000 people in Mary Miller's district are at risk of losing their health care. That is one district in Illinois. And get this, Medicaid covers over 40% of births in Illinois. That's very pro-life of you to vote for the Big Beautiful Budget Bill, Mary Miller. It's not just local families that are going to be hurt either. Farmers are going to lose as well. With SNAP benefits seeing the largest cut since its conception, they are expected to lose $24 billion worth of sales over the next 10 years. Because when people can't buy groceries, they don't buy local produce. And the most conservative part of all this is the Congressional Budget Office says this will add $3.4 trillion to the deficit over the next 9 years. And the kicker to all of this is Mary Miller voted and supported this. Mary Miller voted to gut your health care, to slash your school budgets, and cut food for working families. If you live in Central or Southern Illinois or District 15, be sure to give Mary Miller a call and let her know your thoughts on this. Because once those hospitals close, they're not coming back.
Everyone's talking about it. The Big Beautiful Bill passed the Senate today by just one vote. It was actually a tie-breaking vote that had to be cast by the Vice President. That's because it was a bipartisan no. And let me tell you why. Let me tell you exactly how it's going to impact Iowans. Every single Iowan is going to feel its effects. Almost 40,000 Iowans will probably be kicked off of insurance altogether because of the cuts to Medicaid. But what's also going to happen is nursing homes and all hospitals are probably going to also feel hits. When we look at Medicaid funding, 50% of nursing home residents rely on it as their primary payer, and even more rely on it to cover part of their bills. And that's why nursing homes in Iowa are at risk. It's estimated that 1 in 4 will probably close if this bill goes through. And when we look at hospitals, that's another thing that relies on Medicaid funding in order to exist throughout our state, especially in rural spaces. If this bill gets through the House at the national level, it means that 1 in 5 hospitals in Iowa could potentially close. So it's not just Medicaid patients who are suffering, it's all Iowans when we look at access to health care being further contracted. That's why this bill sucks and it needs to go away.
The government is a major payer in our healthcare system, and healthcare works like an ecosystem. So when the biggest investor pulls back, the whole system feels it. Hospitals close, especially in rural towns, because they can't cover the costs. Staffing shortages pushes nurses and doctors to burnout. Patients wait longer or go without care altogether. Cutting funding doesn't save money. It shifts the cost to families, small businesses, and the people who can least afford it. Healthcare isn't just an expense. It's an investment in us. It's an investment in people, in productivity, and life itself.
Who would have thought doctors would lose their jobs? But doctors are being laid off as well as nurses. And I've been doing the research, and this is the conclusion that I've come to. The Medicare fees that were being charged to Medicare by hospitals and or clinics were so inflated and so high and had so much profit built in that now that they've been reduced and now they're at the levels where they're supposed to be, the people who wrote the budgets didn't account for this. Therefore, it's going to look like they're losing money and they're not profitable. So, like every other corporation out there, when you're chasing a number, if you're publicly traded, the easiest way to get there is to cut staff. And you'll hear these doctors say, I had lines, there was 6 months worth of appointments set up. It doesn't matter. If the hospital doesn't see the profit, the people that get cut first are those that work on salary. So they're going to have to take some time to adjust back down to where they were actually supposed to be, what they're supposed to be billing Medicare instead of the inflated numbers that were being allowed. And that is exactly why we see so many doctors and nurses being laid off, because they didn't account for losing as much profit as they did when they flipped the switch and dropped Medicare cost down to where it's supposed to be.
The chaos and the dismantling of the CDC this past week should frighten all of us. Yes, it started about 6 months ago. It's kind of been a death by 1,000 cuts. Let's talk about that. Layoffs and resignations, content censorship, and grant funding being rescinded should frighten all of us. And then this past week, the CDC director was fired. 3 longstanding leaders at the CDC, as well as others, also resigned because of everything that's going on. Healthcare providers are calling this a disaster. And for those of you that aren't very clear about what the CDC does, we'll talk about that. The CDC has been the leader and powerhouse around the world, and it's been operating for over 80 years with many accolades under their belt. The disease prevention has been on evidence-based science. Malaria was eliminated in 1980, and smallpox that used to kill a third of the people that got it and left the rest blinded or disfigured has been eradicated as well. National experts were brought together to collaborate on the SARS virus, the Zika virus, and Ebola. Some CDC websites or links have already been removed. I'm having to revise my book I wrote a couple years ago because I had links in there to look up the evidence on the CDC website. Those are gone. Approximately 70% of the CDC's funding goes to state and local governments to take care of public health issues. The funding has helped local cities do public health education, take care of their labs in the public health department, and workforce training. This is the first line of defense to keep our nation healthy. The CDC has been in front of infectious outbreaks, chronic diseases, and environmental exposures. With funding cuts that is going to impact staffing, supplies, and services that especially rural or low-income places in our cities and our counties. These are going to be impacted at the highest levels. The CDC has had many programs that help U.S. citizens across America. Infant mortality, chronic diseases such as diabetes, strokes, and cancers. What are we going to do without this funding? It's estimated that the CDC's infection prevention programs have helped hospitals prevent 4,500 deaths, as well as saving $3.3 billion. Its HIV prevention programs are estimated to have saved 350,000 HIV infections. The CDC is also the command center for natural disasters like hurricanes. Well, I think our country is heading for a natural disaster in our healthcare. This complicates an already complex and broken system.
Okay, so Trump's budget is already having an impact with regard to Medicaid cuts. And please interact with this video so I can stay out of algorithm hell. So there's $1 trillion in Medicaid cuts over the next 10 years. This is a primary form of health insurance for people who are in poverty, who have disabilities, and so forth. And already you guys may have already seen the one gentleman talking about how his wife, who works for a children's hospital, they had an emergency meeting with the staff about how are they going to be able to afford to take care of children. Now, if you've ever been in a children's hospital, these are the innocents. These are the innocent children who are battling really serious stuff to have to go to a children's hospital. They've got their burn units. This chokes me up because I used to do dog therapy there, bring my greyhound there. Cancers and all kinds of stuff. And, the staff at this children's hospital was stating that so many of the children they treat are on Medicaid. There's a lot of rumors by MAGA supporters at how this is going to save Americans money because illegals are no longer going to be getting Medicaid. They never did. They never could. And once you become naturalized, you still have to wait 5 years to get access to it. So this isn't going to hurt them or save us any money. It's only going to hurt Americans. It looks like 300 rural hospitals are preparing to close over the next couple of years. They were already struggling financially, barely staying afloat. One smaller hospital in Curtis, Nebraska just closed and said it was due to the budget cuts. Like they have been struggling to keep it open. Now, there's a lot of Republicans who live in these rural areas. So I don't know if you guys have ever been in an emergency situation where you call an ambulance and like within 15 or 20 minutes you're going to be at the ER. No, you better hope that you don't have to wait. You can hang in there for 40, 50 minutes, however long the drive is going to be. You're choking on something, having a heart attack. This is painful. Kentucky, the red state of Kentucky, is set to lose the most, $12.3 billion. Like other red states, it has one of the highest poverty rates. I don't know why these red states who have been perpetually in poverty keep electing Republicans that are helping to keep them in poverty. In Kentucky, it's looking like 35 rural hospitals will close and over 200,000 Kentuckians will lose their health coverage.
According to the National Council of State Boards of Nursing, over 900,000 nurses are projected to leave the workforce by 2027. That's nearly 1/5 of the entire workforce.
Yeah.
That's the end of the quote. But on top of that, you have an aging population that is also rapidly growing. So those two don't match up.
Not at all.
Nope.
So that is a big problem.
Yeah.
I live in a super rural area in Illinois, and recently our local newspapers have started posting about hospital closures and how Medicaid and Medicare funds our hospitals and our nursing homes, and how there's a lot of fear surrounding Medicaid and Medicare cuts and possible job loss, possible department closures, and there are like about 100 MAGA in each post, and they're just like, show me the data. I want to see the numbers. Show me the financials. Like, they'll understand it. It's just so comical to me. They are telling you, we have already closed our OB department. We have already closed this clinic and that clinic. People are already driving an hour to an hour and a half for healthcare, especially women's healthcare or mental health. People are still in disbelief, like the newspapers, oh, you're just a liberal newspaper. Look at you've gone woke. It's not woke in a bad way to understand how these cuts and these policies impact us, especially in rural areas. Like, you have to wake up and face reality at some point that you voted for this, and now you're going to be impacted. Your neighbors, your friends, your family, we're all going to be affected by this. It's your fault. You have to open your eyes and realize that. You can't just live in denial. They're telling you they're going to close. When they close, are you still going to be in denial? No, you're going to blame it on Democrats somehow.
So here I am walking into my last shift in the emergency department. And it's not because I'm retiring. I wish it was because I was retiring. Actually walking into my last shift here in Delaware County, Pennsylvania, because the company that owns this hospital and another hospital in Chester, PA, are shysters and criminals and have stolen everything. When you make over $250 million as a CEO of a company, and then you close hospitals for people in need in communities that are fairly densely populated, including a trauma center. People are going to die, and that's what's going to happen, and these people should be held accountable. Thousands of people are losing their jobs by the end of this week, beginning of next. It's a disgrace. I've been in the medical field for 35 years, and I've worked in the emergency room now for over 22. There's nothing else you can say about it. It's a sad day. It's a sad day for Delaware County, Pennsylvania. It's a sad day for all the staff. I know hospitals aren't perfect, systems are broken, but when you intentionally pad your pockets at the result of people not being able to get care, you are immoral, you're a disgrace, you're unethical. I'm sure there's lots of nurses that I work with that all feel the same way, doctors, housekeeping, kitchen staff, ancillary staff. So here's on to a new adventure in the nursing field. I don't really know what I'm going to do. But I like patient care. I like taking care of people. I like taking care of all people. I don't care who you are. Well, I'm an ER nurse, so that's probably not true. ER nurses do know that.
My name's Amanda Pushek, and I'm running for Congress because 52 hospitals in the state of Alabama are at risk for closing in the next 2 years. As a nurse, I know that just means more preventable deaths, and I'm ready to fight for the people who deserve it.